Welcome back to today's episode, where we explore a study that highlights an unexpected finding from routine lung cancer screening: coronary artery calcification. Yes, we're talking about those low-dose chest CT scans primarily intended to detect lung cancer, but increasingly, they're uncovering something else: calcium deposits in the coronary arteries. So, why is this finding important? Researchers in Ottawa conducted a large retrospective study involving 1,500 current or former smokers, none of whom had a prior history of heart attack or coronary procedures. These individuals underwent CT scans for lung cancer screening, but what the scans also revealed was striking. About half of the participants had mild to moderate coronary calcium, while 30% showed extensive calcification. Here's the kicker: during an average follow-up of just over 4 years, the incidence of adverse cardiovascular events was significantly higher in those with extensive coronary calcium, 5.5% compared to just 2% in those with mild or no calcium. Even after adjusting for other cardiovascular risk factors, extensive calcium remained a significant predictor of heart-related events, with a hazard ratio of 2.06. Now, this raises an intriguing question for clinicians: should an incidental finding like this change how we manage cardiovascular risk? One of the key takeaways here is that substantial coronary calcium found during a lung cancer screening could be a signal to revisit a patient's overall heart health strategy. It might even serve as that extra nudge for patients on the fence about starting preventive measures, such as statin therapy. It's also worth noting that the high prevalence of coronary calcium in this study population might be linked to the fact that 2/3 of participants were still current smokers, a group already at high risk for both lung cancer and cardiovascular disease. This study underscores an evolving trend in radiology, where incidental findings on routine scans are becoming more common. While these findings were once seen as irrelevant noise, they're now proving to be valuable data points in broader patient care. As we wrap up today's discussion, it's clear that lung cancer screening isn't just about early detection of cancer anymore, it's evolving into a more holistic tool for identifying major health risks. By being mindful of these incidental findings, clinicians can open new opportunities to intervene early and potentially save lives. Thanks for joining us today. If you found this episode insightful, don't forget to subscribe and share it with your colleagues. Until next time, stay proactive and stay healthy.